Well, good afternoon. This past Friday, I traveled to Ottawa and stood shoulder to shoulder with my fellow premiers. We were there advocating for priorities that are important to the people of Ontario and to all Canadians. And no matter which part of the country they represent, no matter what political stripe they come from, we all agreed that healthcare is the #1 priority. Healthcare funding is the key issue as we head to the Council of Federation meeting, the meeting of Canada's premiers later this week. And it's a critical issue that Ontario expects the federal government to address in their upcoming throne speech, and it's absolutely essential because we need to build a stronger, more resilient Ontario, a stronger and more resilient Canada. All of the provinces and territories are making unprecedented investments in healthcare. Ontario is putting over $67 billion towards healthcare this year and $4.8 billion for long-term care. But it's not enough to keep up with the growing demand. We need the federal government to step up. Right now, the federal government is only contributing 1/5 of the bill for healthcare. Not long ago, healthcare was a 50-50 partnership. Today, healthcare costs are rising by 6%, compounded year after year, and the federal transfers for healthcare are growing by only half that rate. That's not sustainable. So I'm standing with my fellow premiers, and we're asking Ottawa to come to the table now to increase their contribution to Canada Health Transfer to 35% share of the provincial spending. Because as the numbers keep rising, we have to respond quickly and decisively, and there's no time to waste. We also need the federal government's help when it comes to strengthening our long-term care system. We need immediately and ongoing supports for long-term care residents and those who care for them. This means recruiting and hiring more staff, enhancing infection prevention and control, and building 30,000 new beds over the next decade with better ventilation and more private rooms. These are critical investments that need to be made now. On another front, Ottawa needs to play a more active role on testing and enforcing quarantine at the border. We also need them to expedite approvals for rapid testing options. This means more testing at the borders, sharing data and information quickly, and making sure travelers are acting responsibly, especially now with the case numbers on the rise. Finally, we need the federal government to step up with more infrastructure dollars to support economic recovery. That means investing $10 billion each year over the next decade in infrastructure across the country. And with the current challenges, we also need access to high-speed internet and reliable cellular service in more communities across the province, better internet for schools, businesses, and families, so they can adapt and stay connected during these unprecedented times. And I will be looking to the federal government to address these critical priorities in their upcoming throne speech, because the threat of a second wave, addressing surgical backlogs, ending hallway healthcare, and building more long-term care beds for our seniors, these are critical challenges, and we're doing our part here in Ontario. This week, Minister Elliott and I will be sharing the details of our fall preparedness plan. But we need Ottawa's support, and we need it now. Let's give Ontarians, let's give Canadians the confidence that they can count on their healthcare system when they need it most.